video will demonstrate the proper order for putting on and taking off personal protective equipment for the care of a suspect Ebola patient. For the purpose of this video, we will refer to personal protective equipment as PPE, putting on as donning, taking off as doffing. Two registered nurses will be assigned to care for a suspect Ebola patient. Nurses do not need to be in the room at the same time or all of the time. An additional healthcare worker, known as a trained observer, must watch healthcare workers donning and doffing of PPE to ensure these procedures are followed correctly. The trained observer will use a checklist and read aloud to help guide the healthcare workers during each step and to ensure adherence to the protocols. Standing outside of the Ebola patient's room, observe the healthcare worker activities, including asking about the well-being of the healthcare worker at regular intervals. If at any time during patient care activities a breach in PPE is noted or the healthcare worker begins to feel unwell, please instruct the healthcare worker to immediately exit the room and remove PPE. During donning and doffing procedures, it is critical to move slowly and carefully during each step of the process, especially when removing PPE, so that you do not contaminate yourself. The zones. Following the steps and effectively carrying them out are as essential to your safety as the personal protective equipment itself. There are 3 zones designated while caring for a suspect Ebola patient. 1. The hot zone, 2. The warm zone, and 3. The cold zone. The hot zone is the area within the patient room and is considered contaminated. The warm zone is near the exit of the room or in the anteroom if one is available. The warm zone is considered potentially contaminated and is used for doffing PPE. The cold zone is clean and is the area in the hallway outside the anteroom or patient room and is used for donning PPE. Prior to donning PPE, ensure you are hydrated, attended to personal needs such as using the restroom, put on hospital scrubs, tie your hair away from your face and neck to ensure it will not shift the placement of the straps of the respirator or interfere with a proper seal. Remove any personal items such as your name tag, jewelry, pens, phone. Secure eyeglasses if necessary for vision with a head strap to prevent movement under the hood. All healthcare workers wearing an N95 respirator must have been previously medically cleared and fit tested for their specific model number of respirator. The following PPE must be worn while in the room of a suspect Ebola virus disease patient. Make sure you have all of the items below prior to starting. 2 pairs of extended cuff nitrile gloves, a fit tested, seal checked N95 respirator, an impermeable gown, impermeable lower leg foot covers, a full face shield, a full head covering. The goal is no exposure of the skin or hair while wearing this personal protective equipment. The trained observer can assist the healthcare worker to don PPE in the cold zone, the area outside the patient room. Are you hydrated and have you attended to any personal needs such as using the restroom?
Yes,
Are you feeling well?
I am.
Good. Remove any personal items such as your name tag, jewelry, pens, phone. Secure eyeglasses if worn. Next, inspect your PPE to ensure it is the correct size for you and does not have any tears or defects. Perform hand hygiene. Apply lower leg shoe covers by sitting on a chair if needed. Extend the leg covering as far up your leg as possible. Put on your inner gloves and extend the cuff as far up your arm as possible. Put on your gown, ensuring full protection between the gown and lower leg covering. Secure the ties. Ensure your inner gloves are under the cuff of the gown. Put on your N95 respirator. Perform a user seal check to ensure the respirator is sealed and has no leaks. Put on your head covering. Make sure it covers your head, neck, and ears with no hair exposed. Put on your full face shield and ensure it covers the entire front and sides of your face. Secure the face shield by pulling the strap tight if this is the design of the face shield you are wearing. Put on your second pair of extended cuff nitrile gloves. If necessary, they may be a size larger than your inner gloves. The trained observer can assist the healthcare worker to don the outer gloves. Extend the gloves over the cuff of the gown as far up your arm as possible. Make sure no skin is exposed. Check to make sure you can move freely in your PPE. The trained observer will inspect the healthcare worker to ensure the PPE is secure and full body coverage is obtained. The trained observer will write the name of the healthcare worker on the gown prior to entering the room, as well as the time the healthcare provider enters the room. PPE. During the doffing process, the trained observer will remain in the cold, clean zone and will not have any physical contact with the healthcare worker removing PPE. While still in the patient room, hot zone, and before entering the warm zone, inspect PPE for visible contamination or any breaches or tears in the PPE. If gross contamination is visible, remove with a disinfectant wipe, wiping away from your body, using one wipe at a time, and discarding into a waste container. You can use a mirror for easier visualization, or if an additional healthcare worker is in the room with you, they can assist with this task. Enter the warm zone. Remember that doffing PPE is a high-risk activity. Do not rush. It is critical to move slowly and deliberately and remove PPE in the correct sequence to reduce the possibility of contamination. Ensure the trained observer is present and engaged before you start removing any PPE. Remove your outer gloves. Using one hand, grasp the outside of the glove, on the other hand near the wrist. Hold the removed glove in the remaining double-gloved hand. Slide one or two fingers of the single-gloved hand under the remaining double-gloved hand. Pull the second outer gloved hand off, removing it inside out, discarding into the waste container. Inspect your inner gloves. Perform hand hygiene over inner gloved hands using alcohol-based hand rub. It is important to remember that the use of alcohol-based hand rub on gloved hands and the use of disinfectant wipes is an exception for Ebola virus disease and should not be used routinely in day-to-day practices. Remove face shield. Grasp the band as close to the back of your head as possible. Lean forward slightly and lift gently away from your face. Do not touch the front of the face shield. Dispose into the waste container. Clean gloved hands with alcohol-based hand rub. Remove head covering. Lean forward slightly and pull gently away from your face by lifting the hood forward from the top of your head. Dispose into waste container. Clean gloved hands with alcohol-based hand rub. Remove your gown by touching the outside and pull it down and away from your shoulders, rolling it inside out as you remove it. Remember, the outside of your gown is contaminated, so move slowly. Take care not to touch your clothing with the outer surface of the gown or your gloved hands. Dispose into the waste container. Clean gloved hands with alcohol-based hand rub. Place metal stool into the warm zone to allow sitting for removal of lower leg coverings. Clean with a disinfectant wipe and allow the surface to dry. Sit on the stool and remove lower leg covering by pulling downward and outward, taking care not to touch your pant leg. Place your foot into the cold zone. Repeat with the other leg and place your other foot into the cold zone. Remove your inner gloves using the glove-to-glove, skin-to-skin technique. Avoid touching your skin with gloves. Discard. Clean hands with alcohol-based hand rub. Remove your respirator. Avoid touching the front. Grasp the bottom strap and lift it over your head. Grasp the top strap and lean forward slightly. Lift the strap over your head and away from your face. Discard. Clean hands with alcohol-based hand rub. Visually confirm with the observer that the sequence has been followed correctly with no breach in technique, and look for contamination on your scrubs. Good, looks good. Enter the clean zone. Document the time leaving the room on an entry log sheet. Ensure you obtain nutrition and hydrate yourself after spending time in this environment. In summary, removing PPE is a high-risk activity. It is critical to remove it slowly and carefully. Be meticulous about following each step properly. Ask questions if you do not understand the instructions from the trained observer. Be vigilant, monitoring for breaches which could result in an exposure. If a breach is identified, remove contaminated clothing if applicable, shower using the contents of the exposure kit, and report this immediately to the manager on site and occupational health for appropriate follow-up.